Perfect, perfect. Well, I'll kick it off as the moderator here. I want to thank any and everybody who will be consuming this today. In the future, we're going to have an amazing show today. One of the things that we want to do as part of this series is while we're focused on the science of cost savings, we really want to tell the story and the background of the people who power Era Group and help build that strong reputation. And what you know it, I have two college friends with us today. How does this happen? We got to get into the background. We'll talk about the results delivered, but I have some back information. You're both connected to physicians, and that gives you a very, very deep understanding of the healthcare industry. Before I get started, let me give a toast to the host with the most, Ed Flanagan. How are you?
Good morning, Chris. I'm doing well. Looking forward to the webinar.
Love it. I love it. So you know how we do before we get started with the professionalism. Becky, what's two things the audience should know about you right now?
I've been with Era Group doing exclusively healthcare analytics with Brie for 15 years. I live in Connecticut. I've got two boys, one that's graduating from high school next week and one that's in college, and I'm excited to kind of talk about how we do what we do.
Are you fearing the empty nest?
No, looking forward to it tremendously and already making travel plans.
I hope your kid never watches that part. Brie, how are you?
I'm doing great.
Good, good. Two things the audience should know about you right away.
I think the audience should know I also have two boys. They're finishing their freshman and junior years of high school, so a few steps behind Becky. I live in Fort Collins, Colorado. One of the wonderful things about Era Group is we're across the entire globe, and you can catch any of us any time of day or night, mostly.
Love it, love it. And before I get started, the host, two things that the audience should know about you.
I've been with the Era Group now for 16 years. I have 4 children, 2 boys and 2 girls. They are all off the payroll, and they have blessed us with 4 grandchildren.
Love it. I love it. And this is going to be a very exciting show because one of the things that's not ever present in your titles here on the webinar is that we're both talking to PhDs, and I have an ultimate respect for that. But before we get started, let's kick this off. Becky, how did you meet Brie?
So many moons ago, we were in grad school together at UConn, and we found that, not only did we love doing the research, but we were also both like incredibly efficient, very like time conscious, very much like, hey, let's get this experiment started and then go grab a cup of coffee versus getting the cup of coffee and then coming back to then start the experiment so it could be running while we were kind of also getting some social time together. And we kind of clicked in terms of our synergies of how we approached and tackled our independent research. And then we were also joking that we were also really fun friends and like actually wanted to go out and hang out on a Friday night together. And so we just started spending more and more time together, and really just it made the whole grad school experience so much better to have a partner in crime. And ironically, that's also where we met our husbands, because they were in med school in the same building, and we kind of just became like a group, and it was pretty amazing.
I love that. Brie, how did you or when did you know that, okay, I've got a partner in crime past grad school. I think this is my lifelong partner in my professional pursuits.
Yeah, I think, like Becky said, we became fast friends, somebody that I could trust, somebody that I knew could read over my my publications and help add some sense in there, because when you're in grad school and you get back a publication, a draft that has only the words A and the that you recognize, sometimes it's good to have a second head in there that says, hey, it's okay, you're okay. This writing's great. So we knew kind of right away that we would work really well together, because even in grad school, we were in different labs, had different types of research, but we were able to help each other with ideas of how to do experiments, thought process, being more efficient, that sort of thing all the way through. So once we left grad school, we both went on to try to do our own thing for a year or two, but we always kept in touch and always knew we would work really well together.
I love that. I'm going to hold on the physicians because we got to come back to that. But Ed, I'd like to talk a bit. So our theme in this series is really around healthcare, and I wanted to take kind of a big picture view as you as a national practice leader and talk about the focus on healthcare. Why, of all of the verticals that you could choose, why is healthcare one of the verticals you feel is best aligned with the Era Group mission?
Well, the thing with healthcare, Chris, is that costs are going up exponentially. And we have the availability with people like Becky and Brie to help our clients, both for-profit and nonprofit, mostly nonprofits, make sure they're not overspending. And we can also find savings where they have additional resources to hire more people, to fund a pet project, whatever it might be. So we really enjoy, working with our healthcare clients. And the thing is, they spend a lot of money in the areas that we're very good at, like medical supplies, pharmaceuticals, durable medical equipment, lab supplies, and we look at a dozen different categories. And even if we can't find savings, we're verifying that they're in good shape. But 90% of the time, we have success in finding savings.
So I have fellow PhD college students, great friends, married to physicians, a specialist on the healthcare side, but there's something, Ed, that the audience may not know about you. You're actually a former client of Era Group when you were sitting in the CFO seat. Can I get a brief but meaty overview of how you came to the point of doing business with Era Group and then joining the table?
Back in 2008, 2009, I was working as a CFO for a home building company, and we went through the mortgage crisis, where everybody was losing their home. There's a lot of people that couldn't afford, their interest rates went up, they couldn't afford the mortgage, and they had to default on their loans. The mortgage companies took back their homes. So being a home builder, we were doing very well before that, but once that crisis hit, the mortgage companies raised the percentages where you qualify people to buy a home and qualify for a loan. And when those rates went up, nobody could qualify. So when I had set up the loans for the various construction sites we were working on, I told the banks that we needed money to buy the land, to put the infrastructure in. We're going to build a model park. And then 5 quarters down the road, we're going to start paying you off once we close houses. We never had any sales, so we could never pay them back. So our company didn't survive, and that's when I got involved with ERA. But prior to that, somebody from ERA came out and said, hey, here's what we do. We help our clients find savings. We share in the savings. If we don't find savings, there's no fee. And I basically said, well, that's my job. I'm the CFO. And I kind of pushed them aside. And then he came back 60 days later and said, how's it going? And I go, well, we made a good start. But then I got pulled over here. I got pulled over there. I never got to it. And he said, can I give a shot? And I said, sure. And within 90 days, he came back with $250,000 in savings. So I saw the process. I met some of the people that were the specialists. And I wanted to work for myself. I wanted to be an entrepreneur. And the thing is, if you want to be in sales, you need a product or service that people need. And I found that.
I think one of the things that's going to be really powerful for the audience to know is that you sat on the other side of the table and you do what normally any prospect of any business does the first time they're presented with an idea, a concept, a solution is no, thank you. I can take care of this. And then once you took the step over, and we'll talk about the ease of process, there was $250,000 plus in savings just sitting in your business. And what you do with that. But before we go a little bit too deep in the business, I got to get back to Becky and Brie. We're in college. We meet physicians because this helped influence the decision you all made to go and focus on the healthcare sector. So, Becky, tell me a little bit about when that healthcare bug bit and you were like, you know what, this is the sector I want to focus on.
So yeah, so it's kind of a fun journey, kind of similar to Ed, where, obviously we finished up grad school, we did our postdocs, Brie worked in industry. Then, I was actually working for, about 2 years and then had children, as many of us do at that nice middle age of your, late 20s, early 30s, and ended up leaving research for a couple of years. So I had a PhD in biomedical science, worked in the research clinics, worked in the labs, was working in an IVF clinic, doing all of this type of stuff. My husband was in residency, doing family practice. We were kind of up to our eyeballs and then threw kids into the mix and decided I was going to step away from research for a little bit to kind of man the home front. And then within a couple of years, I was approached from someone in Era Group to kind of say, hey, I need some of your data analytic brains. And I said, yeah, great. As long as I can do it after the kids go to bed, I'd love to. And so the bug bit pretty early on, because once we joined in with Era Group and I started doing things like thinking and looking at the analyses and troubleshooting and all of this, I kind of was like, oh my God, I miss this so much. I want to go back and do this, but I need the flexibility of being able to also be a consultant where I'm not having to go feed the cells at midnight on Christmas. And so that was kind of when it started, is let's work in consulting. We're still going to leverage and utilize all of our experience and knowledge from working in the clinics, working in the labs, being married to physicians who are complaining about their gloves every single day, and then, you know, figure out how to marry all of it together and really be able to be that bridge between what the clinician needs and what the C-suite needs, because the financial part comes from the analytics, and the personal kind of what clinicians want and what patients need comes from that other arm. And then within a year of saying we're only going to do healthcare analytics, we were overwhelmed. And my partner at the time said, we need to clone you guys. And so then I'm like, I know someone. And that's when we got Brie involved, and she took it and just scaled it to like another whole level. And I'll let her continue.
Love that. I love that. Okay, so we're going to come back to the gloves thing, because I remember in our first discussion when we met, you talked about the fact that sometimes it's not always best to drive the cost to the bottom because there could be a quality issue. And when you're talking about being in a medical environment, gloves that rip, something that you won't see on a balance sheet, but you'll get the feedback from the clinicians that ultimately impacts decisions that you make. So I'll pivot to Brie. So you all have the inside track, being married to physicians. How does that help you understand the operating environment? Because these are not just numbers, these are actual processes for operating a clinical environment.
Yeah, and Chris, it's a great question. Not only am I married to a physician, my husband's chief medical officer of his group, deals with both being in the clinics, he's an anesthesiologist in the hospitals, as well as doing the kind of business side. Both of my parents are physicians. Both of my grandparents are physicians. I come from a long lineage of a lot of physicians. And so I really grew up eat, sleeping, and breathing the world of medicine. I really thought for a long time I would go on to medical school until I found grad school, and I loved doing research. I loved learning about research. So I think that you're absolutely right. I think that Becky and I have been able to marry both the analytical side, my undergrad's in engineering, so I could come in, I understood processes, I understood spreadsheets, I understood data. Looking at that, my PhD is in biochemistry and structural biology, I understood science. But more importantly than all of that is the understanding, the communication, and the being able to relate to our clients. The relationship piece matters so much. And so what you're asking is really, really viable, in that we can go in and talk to clients and we get it. We get what it's like to put on gloves that rip. If you have a clinician that has to put on 5 pairs of gloves, that's not cost savings to our organization, even when you're looking at the per glove cost, right? So we're able to sit down and we say, we get it. We understand what that's like. Let's look at exactly what you do like and see what we can do to get the best cost savings for those items. So I think just coming at it from a position of we've talked about this at the dinner table my entire life about what it's like to be in the healthcare field.
I love this. And this now sets the stage. We've now put the foundation down for why this is the science of cost savings. It's one part academia, one part passion, one part lineage. I just found that out. But ultimately, it's really about the approach. And so I'm going to go back to Ed, and I want to talk a little bit about the structure at which Era Group engages the market. One of the things that got me hooked was the contingent process. So I've been in the corporate sphere where I've had to make decisions about bringing in vendors of a sort. Maybe it's for a cost savings project, maybe it's an efficiency project. And the very first thing we have to evaluate is how much will it cost to get started? It's one of the worst decision points, because oftentimes with the higher cost, maybe the higher quality. But Era Group has changed that model completely. And they're in the contingent market. So Ed, you're back in the CFO seat. You finally, the person broke through 6 months later, and then you're like, okay, I'll give you a shot. What happened after you said, I'll give you a shot?
We're successful and they found savings. The nice thing about the model, Chris, is we've been doing this for 32 years now, and 90% of the time we find savings. 2/3 of the time, the savings come from the current supplier. So in most cases, the only thing that changes is additional cash flow. The nice thing about the model is if we don't find savings, there's no fee. So we're willing to take that risk. And the client gets good news one way or the other. Either we pat them on the back and say, you're kicking butt, or we say, hey, we found savings. And then we stick around for 3 years and make sure the savings come through by performing audits every month for 36 months.
Love that. All right, let's get to the specialization. Government-backed healthcare organizations. So in one of our original conversations, Becky, you were kind of explaining to me the business imperative. Now, you know, we're going to stay net neutral here, and we're just going to talk about how funding is now distributed across healthcare organizations, nonprofits especially, who are going to be seeking ways to make more with less. So, Becky, can you talk to me a bit about how you show up in an environment where there's a lot of stress because there's less money now? And ultimately, how you guide the organization to realizing opportunities to make more with less?
Absolutely. And we're seeing it kind of across the board on actually both sides of the equation. There's the physicians, the clinicians, the staff are required to do so much more with less, even in terms of maybe there was 3 people in the department and now there's 1. Maybe they used to have a dedicated procurement person and now the nurses are placing orders in between visiting in, like, you know, rooming patients. And so we're seeing it on that side. And then we're also seeing it on the supplier side. Maybe somebody who had a territory that was only New England now has the entire East Coast and is expected to be able to service that many more clinician groups. And so what we provide is an extension of our client's team. We can come in and provide that additional set of hands, and in Brie and mine's case, 4 eyeballs, for, you know, kind of really give them a lot of education, knowledge, and just tactical. Let me do that for you. Let me go out and get you 3 quotes on this autoclave so you don't have to, and you can go back to treating your patients, which is way more important. And so with the kind of nonprofits and especially the federally qualified health centers, they're nervous about where their funding is coming to next. A lot of the groups have scaled back in terms of personnel, and staffing is a real problem. So what we bring to the table is just Ed can put together a team of 15 people in various categories to lend expertise to be able to kind of fortify the departments that maybe have been potentially, you know, downsized over time.
Absolutely. So, Brie, you know, one thing, Becky, you have amazing bedside manner. So if you ever want to get out of the numbers and get into the practitioner work, I definitely would love to have you deliver me bad news. But we talk about delivering good news, right? And so, Brie, one of the things that I think is really interesting that Ed pointed out is that 2/3 of the time you're not displacing the current supplier of any kind, right? Because it's not just a human relationship between the supplier and whomever the person who selected the supplier are, and suppliers do a good job of relationship building, but it's also the materials, the quality, the speed, the responsiveness. There's a lot to it. So, Brie, when you're looking at the numbers, right, and it's at 1/3 of the time where it's like, ooh, we might have to present alternative options. What is your approach to helping a leader understand the decision points in determining whether or not the change is worth the savings?
Yeah. First and foremost, when we deliver options, they're truly options. Our clients get to choose. They might choose that, gosh, it is too much risk to move and we're going to stay for very little savings or no savings. So that's the first thing. But in the case where we're presenting an option that is significant enough for a client to potentially change to a new supplier, I think that's what you're asking about. The approach we take is making sure that first and foremost, we reassure them that the products they are looking at are exactly the same. We look at like for like products. We are looking at manufactured products. So even though it might be arriving on a different kind of truck, it's the same product that their clinicians are used to trying. So that's the first piece of making sure that that piece is there. That's Becky and I spend a lot of time making sure that it's exactly that. The next piece is making sure that we reassure that we're there to help with the implementation process. We act as a triangle of communication between our clients, the suppliers, and us to make sure that the process goes smoothly. If there are implementation calls that are on a weekly or biweekly basis, one of us is always on those calls to make sure that we're understanding, to making sure that the products get loaded correctly into their system, making sure that we're there for as much of the hand holding as they want. There's some groups that might say, you know what, I understand how to use this website. I don't really need your help to get on and order. And other groups that say, you know what, I'd really like somebody to sit and share screens and walk through. So we're really customizable. We make sure that we understand the client's needs.
Like that. I like that. So you know how we run our shows. It's the end of the first quarter. We're going to take it back to the personal side, right? Um, you're out of college. I'm gonna go to Becky first. Ed, I'm gonna touch on you and your transition out of the CFO, and then Bree, you'll take it home. But we're out of college, and we're looking around, and we've started to make some inroads. Becky, you're about to make this call to Bree. How did you know you were going to close her? Because it seems like you knew when you called. He was like, "Hey, we're coming right back." How did you know Bree was going to be like, "Yeah, I'm ready to go"?
I mean, had been friends. Like we knew from the minute we met that like we just synergized really well together. Her strengths, she complements like where I'm not super strong, she's amazingly strong, and then vice versa. So that way there, we really can kind of be that amazing, almost like, you know, when you see a duo that you're like, oh my God, that person like crushes it on this aspect, and they're kind of maybe there, then the other person steps in and is the rock star in that department. You're kind of like, man, together we're unstoppable. And I knew that, you know, she would, like, we had been talking, so like I knew we were both kind of in that same world of like, it's awesome that we're doing what we're doing, but man, I wish we could do something that had a lot more flexibility, variability. And, you know, we didn't want to just be pushing the same button every single day for the rest of our lives. And so joining Era Group really gives us the opportunity of, yes, we do medical, dental, laboratory, pharma every single day, but every single client is different. Every single situation is different. And I knew from the scientific kind of discovery, like both of our brains work like, I want to figure out the next thing. And Era Group lends itself really well because it's not cookie cutter. Like we can't say, oh, I've done an FQHC, therefore I can do this one. It's like, well, no, every single one is going to be different. And that's kind of the really exciting part about being able to work in this group is that, yes, there's standard processes and there's standard deliverables and there's a certain, you know, 10-step process that we follow. However, every group is so different, and I knew she would love that. And I don't know, I guess when we talked, it was just a no-brainer, like, yeah, where do I sign up?
I love it, right? Because part of what I want to do as a moderator is really talk about the culture. Everybody that I've talked to in the company is incredibly ingratiating. I love the radiance that you all have. You can tell you all love what you do. So I'll ask Ed this. So Ed, you're CFO. It's time to join Era Group. Your move into the national practice space, you seem to focus on pairing the right teams together. And Becky and Bree seem a rock star team. When you are looking in the market and seeking to build relationships with CFOs, why is the team approach so effective, Ed? And then ultimately, how does that allow for you all to, across 50 categories, identify those cost savings in a way that really makes a material impact to the bottom line?
The interesting thing about our organization is that everybody involved has equity in the company. We don't get paid an hourly rate. So if I were to engage Becky and Brie to help me on a medical category, I know that they're going to be working their butts off to get to savings. Prior to joining ERA, I worked in public accounting and then in the home building industry. And a lot of guys just, you know, they sit back and they build a client and they're not really working that hard. And this is a little bit different. So the nice thing about the ERA group is I get to pick and choose who I want to work with. And if I pick somebody and they do a good job and they make me look good, we're married. If I pick somebody and they don't come through, the next project I have, I'm not going to use them. So it's nice that there's not a partner or a manager telling me who I got to work with. I get to pick and choose. So I really enjoy that. So the nice thing is we have experts all over the field in 50 different expense areas. And it's really nice to have, you know, that support cast to make me look good.
Love that. I love that. Okay, so Brie, we've gotten past how she closed you.
Yeah.
You remember your first big win? Like, but take me in the details. Let's talk about the savings. Let's talk about the approach. Do you remember that first big win you and Becky had, or one of the major milestones where you were like, we love everything we've done up to this point? What was that? What was that moment?
Yeah. I think for me, so much of this is based on not only marrying the data analytics, but then the relationship, the team building aspects together. And so what I remember as being one of the big first wins was when we were able to scale the company up. Like Becky said, when I first came in, she and another colleague were there, but they were kind of up to their eyeballs in data analytics. And because of my background and how it synergized with Becky's, but was slightly different, I was able to come in and write some macros, really be able to grow our business so that we could scale it, so that we could take it to that next level. And so for me, not only was it delivering savings to that first client, but it was the ability to say, gosh, we can now take on 10 more clients and be sure that we are delivering accurate work. I think one of the big things that Becky and I have really set as a mantra, if you will, is making sure that whatever we deliver is the most accurate as possible. We are humans, we make mistakes, but we try really hard to set into process double checks, making sure that we can get that data as accurate and correct as possible. And a lot of it is the ability to scale. You can't work 600 hours in a week. That doesn't work. So how do we make it so we can deliver the best product possible? And so to me, that was really the biggest first win, where I was like, wow, this is amazing. I can actually feel myself contributing and then really connecting.
Love it. So what it really sounds like is that Becky's kind of on the front end, making sure the clients soothe, they love everything that you're doing the executive side. And Brie, you sound like the scientist in the background, looking at all of the processes and putting together the value added and the differentiator. One of the things that I keep hearing over and over as we meet as a team is really around the approach to science, right? It's no coincidence that the approach that you all take across the categories, although you have spin view technology, which Ed will get to in a bit, you all actually take it a step further as PhDs. There's a process and a rigor behind your practice. Becky, the big win that you had in your career where you really knew, like, I'm making an impact on the businesses. Is there one that sticks out to you?
I mean, from an impact perspective, it was one of the first federally qualified health centers that we worked for. We had done a lot of, physician groups and small hospitals and things, and it was, fantastic work. And I remember we were sitting in the meeting and we delivered, it was moderate. It was like $100,000 a year in savings. It wasn't like we were like breaking the bank for them. And I remember watching the CFO's face light up, and he smiled and he goes, "Oh my God, we're finally going to be able to open our behavioral health clinic." And that hit me so hard, because I was like, wow, me sitting at a computer for a bunch of hours and working with Brie, negotiating with suppliers, is now going to allow a behavioral health clinic to open up for an underserved population in New York. I'm like, okay, so maybe what I'm doing is more impactful than I was thinking at the time, because my friends all joke with me, like, you spend your entire day looking at spreadsheets? And I'm like, yeah, I do. But then when you kind of see that end result, you realize that, wow, what we're doing really can make a difference in the businesses. And so that's when we started really focusing hard on the federally qualified and the nonprofits, because not only is it delivering them cost savings, but then it immediately gets put right back to their mission. And to me, that just kind of sealed the deal on what we do.
Social impact. I love it. I love the fact that you can tell that story, because it's the interesting thing. We get into business and we get narrowly focused on what our outcome is. So if I can, describe the outcome is, hey, I'm going to deliver 250,000 to the bottom line. Now, what the business does with that, if you're the CEO, you're basically somebody in product, you're somebody in marketing, is you can take that savings and actually turn that into revenue or new services or new opportunities. So it is far more impactful to know what you can impact, because at times we get narrow and we get focused on, well, I saved this amount of money. And what you just said is, no, I just opened a behavioral health clinic. And how many more behavioral health clinics can be opened to service the population as we have a growing mental health crisis? So this is important. I hope that the people who are consuming, especially if you're in the nonprofit sector and you deliver mental health services, really take a look at how easy it would be to get started. So I'll go to Ed. Ed's our business person. One of the things that attracted me to the table and got me involved early was the spin view technology. The ability to take data that you already have in-house and benchmark it against 40,000 projects so that you can get an understanding of what is potentially underneath the hood. Ed, can you talk a little bit about SpinView, the ease of getting that analysis started, and how that leads into opportunities for Becky and Brie to deliver potentially new behavioral health clinics?
So SpinView is a customized software that we developed. And if we can have the client give us 12 months of activity of their general ledger, their expenses, not including salary, because we don't cut heads, We're not part of Doge. And if we get that data, we can come back and provide them with an analysis where we'll look at their range of vendors. And we find a lot of times the Pareto analysis where 20% of their vendors is taking up 80% of the cost. And we see this big tailspin and we're saying, why do you have all these vendors out there? And the high level management people don't realize that. So what we're able to do is consolidate vendors. The other thing we do is we project out savings over the next 3 years. So the savings are based on our results over our 30-year history. And once the prospect sees the opportunities for savings, the next thing they say is, when can we get started? So it's a real good way for us to get data. We ask them to download the data into a secure portal. We get that portal, we send it to our data scientist. They massage it and come back with a nice report, and then we present it to the client and get them excited about finding additional cash flow.
Love that. I love that. And so this is a contingent process, meaning that until savings are realized, there's no dollars exchanged. So for those out there, if you've been in the decision-making space and you're like, what is it going to be costing to retain? Era Group has the contingent model, which you really have to get involved in. It's quick, it's efficient in terms of being able to understand the breadth at which you can impact the organization. Brie, here's a question for you. What are those categories that like you just know, if I get analysis on these categories, I'm going to make an impact, whether it's the dental practitioner, whether it's a physician's office, a large scale hospital, or it's a nonprofit. What categories where I'm going to be able to find savings?
It's a good question. I think that the true answer is we never truly know, but the ones that I'm most excited about and that I know we can typically make a big difference in is when we come into the federally qualified health space. Obviously, Becky and I focus in medical, dental, laboratory, that sort of thing, and almost always we can find savings there. But where we can kind of move the needle the most is sometimes in those federally qualified health centers where honestly they have one person wearing 10,000 hats, and tomorrow it's going to be 10,001. If we can take even 5 hats off that person's shoulders and be able to look at it from not only a cost savings piece, I know we're going to be able to drive that money, but also we're going to be able to help with their process, help with maybe making their lives just a little bit easier. To me, that's a huge win on top of the savings.
Love that. Halftime. We're at the halfway point here. I really want to focus on the federally qualified health organizations. I really want to narrow in on that. And because the science behind cost savings is one thing, but really it's about understanding your niche and really dominating that niche. Becky, why should a federally qualified health organization be reaching out or engaging with you and Brie as you have developed a specific sphere of excellence around this?
Great question. So a lot of it is because they offer so many services across so many areas that there's a lot of opportunity. And so, a lot of times when we engage with a federally qualified, there's potentially 10 different areas that Era Group can come in and affect change. And so it's not just medical, it's not just dental, it's literally everything from uniforms and linens to telecom to insurance, and really being able to encompass the entire scope of their, products and services is why we can really affect the most change. I'm just trying to think of like areas where, we have a lot of really deep relationships with the suppliers. And so it's not just kind of working on one-offs, because we've worked with over 60 FQs across the country. We now know the local reps, we know the regional managers, we know the national players, we know all of the pieces to help align them and really kind of get them the best opportunity that they can. And then, like we said in the very beginning, and then come back and present options. We're not huge change agents. They've got enough on their plates alone. So let us bring in the resources and the relationships to help make their job that much better.
Love that. I love that. All right. So we have our first question from Michael Smith. And I want to thank you, Michael, first for attending. I'll ask the question, and anybody can jump in to answer this one. While we all understand anecdotally that federally qualified healthcare organizations are watching costs, slow staff, tasking staff with extra work, is the error group seeing anything specific that is threatens funding by the current administration? Who wants to take that?
All right, I'll go. No one else will. So I mean, with the current administration right now, with a lot of the grant freezes, there's a lot of concern over whether or not some of the funding will continue. And so their budgeting has been disrupted in terms of what they used to be able to say, okay, I know I'm going to get $10,000 for this project or this program, and then this program was going to receive this. They get a certain also amount of their funding from Medicare and Medicaid. And if those change, then their reimbursement is also going to change dramatically. And so because of those funding cuts, we kind of always say is, okay, well, we can't control what's happening on that side. So let's control what you're paying out. So that way there we can try to balance out if there is ever going to be an increasing gap between what your costs are and what your reimbursement is. And so that's why we'll typically look at the consumables and the services to be able to see if we can't close that gap due to potentially reduction in funding and grants.
Yeah, and I think along with those grants, sorry, because I think along with those grants, there's a huge unknown around how will that impact their ability to pay different clinicians. And therefore, if we can help save money on the consumables, there's that extra little cushion there that they can use as bonuses or in other ways to ensure that they can hold on to the clinicians that they have.
Love that. I love that. Ed, you want to contribute anything on that one?
Yeah, I know some of our clients have put our process on hold for right now because things are so up in the air, and hopefully we'll get started soon, but we're still waiting.
So the interesting thing about the pause, and thank you, Michael, for that question. The interesting thing about the pause is that this is contingent. And what that means is if you all are stepping in, you're acting as an extension of the team, you're coordinating as the triangle between the supplier of the organization and the internal team, the desire to pause as you figure out the funding side, you could run out of runway when you don't have to. So Brie, let's get your bedside manner. You get that conversations like Brie, we really want to realize what's been projected, but we want to put that on hold. How would you counsel the client on the benefits of realizing the cost savings with the understanding that the organization's feeling that external pressure?
Right. I think while it is absolutely accurate that these organizations are feeling that external pressure, we can come in and be an extension of that team. We can come in and take a look, and we're contingent. There is no money due to us unless we find cost savings. And so we come in and we do as much as we can behind the scenes. One of the fears is because there's extra time being spent looking at what's happening today in this world. So how can we reassure them that we're there to not take up any more of their time than we have to? In fact, we're here to take a few hats off of their heads. So coming in now, being able to take a look at the books now, being able to take a look at, hey, can we help get 10, 12% savings in 10 different cost categories there? What could that do to help just build a little bit of a cushion for you all with not very much time from our aspect? And again, it's a contingency model. If we don't find anything, there's no cost to you.
So then that would make sense and stand to reason, because typically when you see extra heads or you see an extra set of emails outside of your organization, you start counting, right? Because I can't, the feedback that Ed just gave is, I don't necessarily understand it from a business standpoint, which is that until costs are realized, there's no expense. But I believe the perception is that because there's an external group, you're billing hours. And I think that's one of the biggest competitive advantages. And I would say that's an incredible competitive advantage. And so to go back, Becky, you definitely the bedside manner, right? So I'll pose the question to you. So a client who you've been working with, and you can see the savings on the other end, you're going to make a big impact. You can see it. And they communicate to you that, hey, we're going to have to pause because of some of the distress around funding, which is let's call it the revenue in. But you're talking about dealing with what's already being put out. You can't control what comes in, you can only control what goes out. So you're in the driver's seat to really impact the business. How do you balance the fact that you know what you know with what's being communicated to you? How do you balance that?
Absolutely. I mean, I think the biggest thing is the reason why people would either want to pause or not engage with Air Group is usually the biggest thing is we've got way too many other things that are on fire. We do not have time to deal with that right now. It's like, you guys kidding me? Like, I can't look at my waste management when I might potentially lose Medicaid funding. Like, you know, it's like this huge spectrum of the CFOs and CEOs are trying to juggle 400 balls on fire. And unfortunately, sometimes looking at what you're purchasing, it's almost like an afterthought. It's like, we just need to get supplies into the clinics. We've got these other huge things that are on fire. And so what we do is we kind of come in and we say, we understand that you have to tackle these incredibly huge fires. Let us work in conjunction with you. While you're tackling this, we can be working on this in parallel. Don't take it all on at the same time, because what happens is, and this is probably true, even Ed kind of mentioned it earlier with his experience, was, yeah, I don't have time for that. And then you come back 60 days later and you're like, okay, do you have time now? And the answer is still going to be no. Everybody is flat out all the time. And so there's never a perfect time. So really our answer to the kind of that reluctance or that pushback is just, there will never be an optimal time. And so let us take that shoulder, that time onto our side. Let us do the 100 hours of work on the backside. Let us do the analytics to be able to present to you in a nice little package of, here's what you need to know, Mr. CFO. We've done all of the work. You just need to give us an hour of your time. And that really kind of can help make them realize that we're not going to be disruptive. We're not going to take up a ton of their time, and they can truly do multiple things at the same time now versus having to stack priorities in from highest to lowest importance.
So it's not just the federal funding, right? We woke up in a trade war about a month ago, and it absolutely rocked capital budgets. It rocked access to capital. Interest rates, right? As they have remained steady, the cost of capital still is a factor. There are so many things pulling and tugging at the finance team. And so, Ed, as you are looking kind of at the national level and looking at specific niches, where is, as a CFO, as a former CFO, where do you counsel your former peers on how to prioritize grabbing those savings that are right beneath the surface? It's easy to grab by trusting the team. How do you counsel in that particular respect?
Chris, the interesting thing about working in industry is you're trying to make more profit, and typically what they're trying to do is to increase revenues. So if you have $1,000 of additional revenue, that $1,000 doesn't drop to the bottom line. There's costs involved in getting that 1,000. The thing about finding savings is if you find $1,000 in savings, it drops right to the bottom line. So the thing is, a lot of times they should be focusing more on the cost as opposed to on the top line, the revenue. And that's where they can make the biggest impact. And that's where we can help them, find those savings.
Perfect. Heading close to that end of that third quarter. We're getting into the fourth quarter. Now, for those who are sports fans, this is when Michael Jordan would start having steam come off of him, right? Because it's just about domination. But domination in our particular respect, as we're communicating today, is really about articulating why the approach to cost savings is really a science. And so, Brie, I'm going to go back to you, and I'd love to understand. What's the most repetitive barrier that you get on the initial? We're talking about when you convert them over, but at the very beginning, there's often hesitancy. What do you often see as the barrier, and how do you overcome it to begin this process of helping the organization realize savings?
Are you speaking about the barrier, the pushback we get to even get started?
Yes.
The pushback we often get is the fear of how much time it'll take. People are worried. We do need data. We need data. We try to take that off people's shoulders as much as possible, but people, they're worried about how much time they're going to have to put in to realize the savings. And one of my favorite things that another client manager did was they were able to show the ROI after the 36 months of the savings, and really show it's about over 36 months, about 4 hours a project, maybe maximum spent. And a lot of that's upfront, getting the data. But if that is the barrier that we see, and we're able to say, guys, we can take this on ourselves. Becky and I work logarithmically better because we have 4 eyes looking at the data. We want to take that data on. Just give us the sheet and we'll take it from there and run behind the scenes. So to reassure that we really understand the pressures in today's world. We understand where Medicaid, Medicare are, and the amount of time that these clinicians and the CFOs and the CEOs are needing to spend in order to just keep their organizations above water. Let us help with those consumables that kind of fall down on the list to look at.
Right.
Time.
Too, like people love to do it themselves too. There's a pride in, oh, I've already looked at that. I can do that myself. And a lot of times they can, but they can't do it as efficiently, and they often miss out on opportunities. So if we have a group that's like, oh, I just renegotiated my contract and I got 4% savings, and we look at it and we're like, we got 24. And it's because of knowing, and that's the science part, knowing what rocks to look under, knowing what contracts to connect. When you look at 100,000 lines of data every single day for 30 clients across the country, you start to see patterns and anomalies, and you start to go, wait a minute, why is that group getting this for $7 in California and they're not getting that in Texas? I'm calling up the Texas group right now and getting them that price. And like really kind of triangulating all of this 30 years of knowledge, experience, and data, and being able to bring that to the table where a single procurement person is maxed out, like Brie said, they're stressed to the gills, and then they don't have the abundant resource of this just mass amounts of data. And that's kind of where we kind of come in with the science part, which is you need to know how to look at that data. You need to know how to find that right piece of information. You need to know what fits into what parts. And then that's really how we can deliver that really amazing savings to the clients, is by taking this, it's like AI. It's like, yeah, the information's out there, but you know how to find the exact piece that you need to plug into this hole to make it work for this group. And that's what we kind of try to deliver.
I think one other really interesting piece is sometimes we have clients that really can, they can negotiate really well. They're really good at that piece, but then it's the implementing piece. They can get this great savings, but have they checked every single line item of every single thing they're purchasing to make sure that they're getting this cost savings that they negotiated? That takes time. That's time that Becky and I have. We also understand we have databases where we can say, oh gosh, we know to look for this contract or that contract. That's the science again. We know how to help our clients to not only negotiate the savings, but to actually achieve it.
So if they had hit the game winner.
Chris, I got an interesting story. This is one of my first clients. And early on, I was in a networking group with a bunch of executives in the Philadelphia area. And they send emails out once in a while looking for help. And here, the CFO of a large hospice in the Philadelphia area sent an email out saying that the government is changing the way we get reimbursed. We used to get reimbursed this way. Now we're getting reimbursed on a per diem. We do this, we do that. And she said, we don't have software. Can anybody help us out? So I got one of our specialists, and we spent a half an hour with her answering all the questions. We had to do some follow-up. We spent another half an hour, not charging anything. And after that second meeting, she goes, man, I really appreciate it. What is it that you guys do? And I told her, I said, we help our clients find savings. So she goes, you know what? How about, can you see if you can find some savings in our medical supplies? So we went through the whole process. We came back with 19.8% savings. And we didn't realize it, but she had negotiated the current cost not very long ago. And she goes, holy mackerel, how did you do that? And we said, well, the people that do the medical supplies, they're in that market every day. And she goes, okay, how about doing this, this, and that? And after 7 years, we found $3.5 million savings net of our fee. And
let me explain what just happened to the audience. I hope people get the basketball analogy with Michael Jordan. Typically, our audience remembers that. You all just achieved flow state. Like, we have been in several of these. It went from Becky to Brie to Ed to Beck. It was great to hear it. So I'll be the Rodman of the team. I'm going to defend something. Here's the interesting thing about what I just heard. In every single one of these examples where somebody relented and allowed for you to deliver, they got a bullet on their CV. You see, one of the things Era Group does incredibly well is you create impactful bullets on CVs. mean, I'm not a CFO, but I'd love to have been the person who made the call to realize $3.7 million in savings, 1.2 million, 1.6, 300,000. These are bullets on CVs. That's what you all do incredibly well. That's why I got behind your brand, is because I realized the minute your customer relents and allows for you all to do the things that you're so passionate about, what you just displayed, they will actually realize more than you, because you are at an organizational level. When they make the call, it's on their CV. And we all know, being on LinkedIn, it's all bullets. We all want to make the calls that make our career special. And so I'd love to round this off. Now we're in it. We don't want to celebrate the championship yet. We'll wait and see what the determination is. But this is going to be an episode we want people to consume, so we won't timestamp it. What we really want to close out with is how easy it is for a CFO, a leader of finance, to get that bullet on their CV. And so let's start with Brie. Brie, let's not contain it to dollar amount or percentages. Let's talk about impact.
Yeah.
What is the impact that you want to leave when you pull away from a customer's table? When you walk away after 3 years, what is the thing that you're proudest of, that you know that you impacted?
I love when the procurement folks feel empowered to do their job even better. They know which rocks to look under after those 3 years. We've helped to transition that knowledge over to them. We've come in, we've brought in savings, we've been able to show them, we've been able to partner with them, and now they're able to drive the train, if you will.
Procurement empowerment. Becky, that you're 3 years in, you've made those impacts, you've been doing this a while. What's that thing when you walk away, I know I impacted the organization? What's that thing?
For me, it's kind of tied to a specific, but it's the giving the insights on that monthly basis, where we really show them things that they go, wow, I did not know that. And they might have been a CFO for 30 years at the company, but it's like we had this one group that the nurse manager every single month would take our reports and show it at her nurses meeting and say, hey guys, look at this. And let me show you that this home hospice and this home agency are spending different amounts, and yet they have the same patient PPD rates, and how come, and let's dive into this. And just the ability to be able to provide like meaningful insight that they can then take and drive results with, to me, is just like knowing that they're, being able to take what we're saying and then implement it into their practices is my big favorite thing.
Becky, Brie, procurement empowerment. Becky, insight illuminator. Ed, you've been doing this for a while now. What's that thing when you're looking at your portfolio, because you're at the national level? What are the things that when you look at and you see the cost savings coming through, what's that thing that makes you go, man, I'm really impacted? What do you proudest of being part of Era Group?
One thing we haven't focused on enough, Chris, is the audits that we perform each month to make sure that the savings stick. The thing is, we can go out and find savings and say, hey, we saved you 20%, good luck. And if they don't follow up and check, what we find is the suppliers take advantage and they start creeping up the price. So once we're auditing and we see a mess up where they overcharge, we tell the supplier, you screwed up, you need to issue a credit back. And once they know what we're looking, it doesn't happen quite often. The other thing we're able to do is when we do our RFP, we put certain SKUs under contract. Let's say it's gloves. We put certain gloves under contract, and what we can tell them in the reports, the audit reports, if people in the organization are buying things off contract, they're not getting the savings that we were able to negotiate. So we're able to let the client know, hey, you got some people that are not buying the things that we have under contract. You need to talk to them, or if you're going to continue to buy them, let's get them under contract also. So these are things that management doesn't know. We bring that to light, and it's very helpful for them running the company.
I like that. And so if I could summarize, empowering procurement, delivering illuminated insights, and supplier auditing. These are 3 highly valuable things that the Era Group brings to the table. And so as we bring the science of cost savings to the close, I want to get back to the humans, right? And because I can tell you really love what you do. Brie.
Yeah.
To the people out here who are considering potentially becoming part of Era Group, explain to them why you made the decision and why you love the decision you've made.
Yeah. Every day I love coming to work. I get to work with my best friend. I get to be on calls with clients, and every single client is unique and needs slightly different things. So no two projects are exactly the same. I get to do data analytics, which I love, but even more importantly, I get to build long-lasting relationships. I love when we have a client and then they end up moving, because that happens in this world, and then they call us up again and they want to do another project. That to me feels like success. So those are all reasons why I've been here for over 13 years and love doing what we're doing.
Love that. I love that. There's a CFO out of the hospice industry that's taken Ed several places with him, and that's a reflection of success. So I bet people out there who are thinking, you know what, I'm really wanting to get into business. Era Group has come across their radar. What is it that has kept you, besides being able to work with your best friend? Brie already took that. But what's kept you, and what keeps you excited about the future with Era Group?
So I think for me, it is you have to work really, really hard in order to get the results that we get. Like, this isn't an easy kind of a slam dunk kind of a business, but really with kind of the process and the people that inside of Era Group you get to work with on a daily basis. So since, Brie stole the best friend thing, there's also the friendships that are built amongst all of the Era Group consultants. So it's like when we go to national conferences and we hear about so-and-so's kid, they had a grandchild, and so-and-so's kid is, like my son's graduating next Friday, and everyone gets excited for us. And it's a real family in terms of what we can bring to the table. And then that translates also into the project work, because when you're friends with the people that you're working with, it's easy to pick up a phone or jump on a Teams call and just say, hey, I'm working with this group and I see a spend that I think would be really helpful if you guys incorporate it into your, review. And just that kind of holistic synergy, that we're not all silos, even though we're all over the country, to really be able to kind of leverage the relationship of the network, and the clients benefit from that really kind of robust relationship and the kind of that, like you said, that synergy within Era Group's kind of ecosystem.
Love it. I love it. So Ed, I give you the final say as a national practice leader. For those who are out and let's say they're on the consulting side, they're not ready yet to fully jump out there, but they really love what they heard and they want to become part of this incredible movement. Ed, what would you tell them is the one thing that would make them ultimately successful should they decide to join Era Group?
The nice thing, Chris, as I said earlier, when I switched from a career of a bean counter to sales, you need a product that people need, a product or service, and we have that. So the nice thing about the Era Group is that we're not focused on just medical. We help manufacturers, we help education. By doing 50 different categories, there's no limit on who you can help. And I really enjoy that. So, today I'm going to meet with a private school later today. This afternoon, I've got a meeting with the drug and alcohol rehab organization. So it's all across the board. And it's nice talking to the clients and the prospects about saving them money. And the thing is with sales, our clients are meeting salespeople and they're trying to make them buy something. And they're saying, get rid of that supplier and bring our supplier in. We don't do that. We're saying, hey, if you're happy with your supplier, let's make sure you're getting the best price. So the nice thing is that we have no financial interest in any suppliers. Our only means of compensation is sharing the savings. So we're directly in line with what the client's trying to do, is to try to find savings without jeopardizing quality and service.
Love that. I love that. And so as we close off the first of many with this team here, I want to first wish Ed, enjoy those grandbabies. Becky, enjoy the soon to be empty nest. Brie, you got a while, so you just enjoy the little chaos there. I love every time we get together. I'm so appreciative and honored for the opportunity to speak with you all. The science approach is near and dear to my heart as a doctoral candidate in business administration. So anytime I can get with practitioners and learn a bit about how you go about making the right decisions that get those bullet points on the CV, I'm going to sit there. And so I want to thank you on behalf of Era Group, on behalf of Becky, Brie, Ed, and myself Thank you for consuming, because I'm hoping for years to come, this is something that you enjoyed. Welcome to the Science of Cost Savings, and have a great evening, weekend, wherever you're listening.
Thanks,
Thank
Chris.
you.
Thank you.
Thank
Bye.
you. Bye-bye.